Good morning. So I'm really glad to be able to introduce our first speaker from one of the CCTS partner institutions. So today's presentation will be by Dr. Mercedes Morales-Alemán, who is an assistant professor at University of Alabama in Tuscaloosa. Her appointments in the Department of Community and Rural Medicine and in the Institute for Rural Health Research. She did her doctoral degree at Michigan State University in psychology, then was a research fellow in epidemiology at the Centers for Disease Control and Prevention in Atlanta, working in HIV/AIDS prevention. And then she came to UAB for almost 3 years as a fellow in the Division of Preventive Medicine in the Health Services Outcomes and Effectiveness Research Training Program there, and now has been at the University of Alabama for the last several years. She was awarded a supplement K equivalent award from the National Center for Advancement of Translational Science that came through the CCTS here and has been a great partner for us. And she's going to talk today about qualitative research and the methods that are effective for that. Thanks.
Thank you. Good morning, everybody. So I just want to start by telling you a little bit about myself and my experience with qualitative research, and then we can go from there. So I've been doing qualitative research for about 20 years. Like Dr. Chaplin said, I did my doctorate in community psychology. So my work is really around community-based participatory research, which means that you partner with community members to better understand the issues in those communities and how to work together to come up with evidence-based solutions. So when I first started doing this work as an undergrad, my tasks included like transcribing audio from focus groups and interviews and that kind of thing, and eventually work my way up to analyzing and publishing those data. So I really love qualitative research, and I'm excited to tell you a little bit about it. So just to start, to get a sense of where everyone is, if you can just hold up your fingers and let me know where you are in terms of your expertise with qualitative research, with 1 being, what's qualitative research? And 5 being, I'm an expert in qualitative research. So maybe 2 is, yeah, I heard about it in a course. 3 is going to be like, I've done a little bit of it. 4 is going to be, I've maybe written a manuscript that's qualitative research, but I wouldn't consider myself a qualitative researcher. And 5 is going to be, I could give this lecture. So, so if you can just, all right. So I see 2s, 3s. All right. Okay. So for some of you, this is going to be more of a review. And for others, I think that there's going to be some new knowledge here for you. So, and feel free to interrupt me, to ask questions. I really don't need to talk at you guys for 2 hours. All right. So, oh, nope, there we go. So let's start with what I hope you'll get out of this presentation. So first of all, by the end of our time here, I want you to be able to discuss what qualitative research is and what that means. I want you to be able to list at least 1 approach that you can take in conducting qualitative research, and to be able to identify and ideally formulate at least 1 question that can be answered with qualitative research methods. Additionally, I think that sometimes people think like, well, I don't have time to do quantitative, I'll just do a quick qualitative study. There are so many steps to qualitative research and to do it well. So we're going to talk through those, and I hope that by the time that we're done here, you can identify a couple of those. So let's begin with a definition, and I like to use Creswell's definition of qualitative research. The reason why I like it is because it's an applied definition. So qualitative research as a field is incredibly interdisciplinary. And some disciplines are less focused on dealing with the human experience, with the purpose of actually doing something about it, with the purpose of actually solving a problem. Some disciplines are more interested in understanding how we think, how we perceive, and but Creswell takes the approach that is more focused on applying qualitative research for, you know, the types of things that those of us that do population and public health, you know, are interested in, which is helping people, right? So that's why I like this definition, but I like to put that caveat in because the field of qualitative research is enormous, and I don't want, you know, someone else to be like, well, that's not the definition that I use. Well, there's lots of different definitions. This is just one of them. So let's start by reading. Qualitative research begins with assumptions and the use of interpretive theoretical frameworks that inform the study of research problems addressing the meaning individuals or groups ascribe to a social or human problem. To study this problem, qualitative researchers use an emerging qualitative approach to inquiry, the collection of data in a natural setting sensitive to the people and places under study, and data analysis that is both inductive and deductive and establishes patterns or themes. The final written report or presentation includes the voices of participants, the reflexivity of the researcher, a complex description and interpretation of the problem, and its contribution to the literature, or a call for change. So there's a lot there, so let's break it down. All right, so firstly, qualitative research is in this definition, is about addressing a social or human problem. So you identify, ideally in partnership with the community that you're trying to help, an issue that you're trying to solve. It occurs in a natural setting. This is really different than a lot of quantitative research, in that you are not going to be bringing people into a lab to do a focus group with you. You're not going to be bringing people into like a sterile space to be doing a qualitative interview with you. You're going to be going out into the communities where they live and work and play to be doing this work. Because qualitative research is about trying to understand the human experience. So being immersed in your natural community makes sense. You can use either inductive or deductive reasoning to do qualitative research, and I'd like to just pop that little figure up there to remind us what that means. A lot of people think that the only way to do, especially the hardcore qualitative researchers from like the 50s and 60s that trained then, that the only way to do qualitative research is an inductive approach, where you have to start from scratch. You go into the community and start collecting information with a blank slate. That's not necessarily true. There's a lot of stuff that we know some about, and we can certainly start with a theory and then work from there. Again, other people are not going to agree with me, but folks who do public health research take this more flexible approach. So qualitative research is about establishing patterns or themes across focus groups, across interviews, across observations. And finally, unlike quantitative research, when you present qualitative research, you will have the actual participant quotes. You will, when you write up a manuscript of qualitative research, you will include the actual participant words. And if you took video, if you took audio, and you're presenting at a conference, you might play that as well. So this is quite literal, like the participant voices are in there. Any questions until there? All right, so the purpose then of qualitative research is to examine complex phenomena and to understand a particular topic in depth, but with regard to the human experience. And sometimes we use qualitative research to shed light on quantitative findings. So sometimes you conduct a survey and the results make no sense. That's a good opportunity to go in and say, okay, what's going on? Why am I not getting what I thought I would get from my hypothesis? So just to tie it all up, we use qualitative research when there's an issue that needs to be explored, that's usually complicated, and also to understand context and settings. We use it to follow up on quantitative research and sometimes to develop theories. So qualitative lends itself well to trying to figure out how things are connected and what the underlying mechanisms are. So you can get that depth with qualitative research because you're hearing people's stories about, the reason why I did this was that. And if you can identify patterns, then you can start building a theory that then you can test quantitatively. And then importantly, qualitative research is about sharing stories and amplifying voices. And I'm very purposeful about using the word amplifying and not giving, which a lot of researchers say we give voice, because communities have a voice. But the problem is that we often don't hear it in public and population health. So this is about giving the community a microphone and being able to bring these perspectives to folks in power, to whomever that might be, policymakers, hospital administrators, depends on your research question, right? And as you might already be able to tell, qualitative research is really focused on trying to disrupt the imbalance between researcher and participant. So traditionally, you have the researcher in the white coat, and somebody comes in. It's a very vulnerable position for that participant. Qualitative research is about humility from the researcher's side and about coming to your participants saying, you are the experts in your own experience. And I am only here to learn from you, to hear your stories and to understand how I can help you. So that's about lens and about stance with regard to qualitative research. And that's also a reason why you go to the communities as opposed to asking people to come to you. All right.
Can I ask you a question about that?
Yeah.
What about issues of generalizability? It seems that one person can't really speak for an entire group. Even a focus group of 30 people is a very small sample of what you want to know.
The purpose of so the question is around generalizability, and if you only have 30 interviews, for instance, then how is that generalizable? It's not, but that's not the purpose of qualitative research. So the purpose of all research is not to be generalizable. And the purpose of qualitative research, as we saw in the previous slide, and we're going to keep talking about, is to examine the human experience to start building out some hypotheses that then, if you want to do something generalizable, then you can do a quantitative study to look at. So it's not going to be, but that's okay. That's just not the purpose of it. Okay, so Creswell summarizes the approaches to qualitative research into 5 main categories. And again, I want to make sure that I point out that this is just one way of sort of parsing this out, right? Okay, so there are these 5 different approaches that you can take according to Creswell to conduct qualitative research. Narrative research, and the goal of that is to elicit stories and identify patterns within those stories. So a question that you might answer that way is, what led you to study medicine? And you might do 50 interviews about that with med students, and it's likely that you will find several stories. Perhaps one story that you identify across interviews is that they had a family member, a mom, a dad, a grandfather, who was a physician, and that led them to want to study medicine. And maybe you identify a second story around maybe they were ill when they were young, and they were really inspired by the physicians who took care of them, and that's what they wanted to do. And perhaps there's even a third story about just gravitating toward scientific subjects in school and being led that way by a counselor, right? So narrative research is not necessarily about just identifying themes, but identifying stories across the different interviews. The phenomenology is about attempting to understand the lived experience of a group. So a question that you might answer this way is, what was it like to provide emergency medical services to the victims of Hurricane Maria? And you might ask that question of emergency medical service providers in Puerto Rico, for instance, right? And so this would be about trying to get at how the person was feeling, what the person was thinking, what that lived experience was like. Phenomenology and narrative research are really closely tied together. Oftentimes you go into the field doing phenomenological research and you identify stories. So there is that flexibility with qualitative to then make sure that you're capturing those as you go through. Then grounded theory, which is a very traditional way to approach qualitative research, is its goal is to develop theory inductively based on an iterative process between data collection and theory building. So you will, if you don't know very much about a subject, you may want to start with just doing observations, with actually going out into the field and conducting data collection. After you've collected some, then you go back and you start building out your theory, how you think that things sort of come together. And then you go back to the community and ask, okay, so is this, does this resonate? Is this how these pieces go together? And you can even go, a step further and do quantitative research to look at it. So a question that you might answer this way is describing the adoption of new teaching technologies in medical education. You might talk to deans and chairs and med students and residents of a med school to try to figure out the things that create a state of readiness for adopting new medical education technologies, right? Then there's ethnography. And ethnography is studying culture and society and worldviews through participant observation. And ethnography has gone through quite a transformation over the last few decades. I think that a lot of us, when we hear ethnography, we think of the researcher like being dropped off in a developing country and sort of spending 10 years there, and it's very top down and problematic. Ethnography as a method, and anthropology, which is where that concept comes from, have evolved since then to have a more to have a better exchange, less of a power imbalance with regard to that. So a question that you might answer with ethnography is understanding how and why patients use alternative and complementary medical treatments in rural communities. And in that case, it might be helpful to go and live in that community. That's what ethnography is. You go and you live in that community, you immerse yourself in that community, you go shopping with them, have your school there, and really become a part of that group of people as a way to better understand their lived experiences. So, yeah.
When you're doing something like this, because I think it's a really interesting way to study a population, but when you're doing it, is the outcome that you're searching for to actually understand why they're doing it, or to hopefully, I guess, transition them towards maybe more, modern medicine like techniques? You know what I'm saying? Like,
Mm-hmm.
when the researchers are doing this, what's really their outcome? I guess maybe it's personal, every single researcher, or is it?
Right. So the question is, when you're doing this work, is the purpose going in to simply understand, or is it to understand with the purpose of changing?
Yeah.
And yes, it depends. I don't know too many cultural anthropologists that would go in with the purpose of changing a community. That is, it runs counter to sort of their ethos. I think that oftentimes public health researchers go in to understand how risk behaviors come to be, with the idea of figuring out that mechanism so that you can do something about it. So it depends on your research question. It depends on your researcher. I think ethnography would not be the one that I would use if I was interested in dealing with a specific risk behavior or risk issue. But it really just depends. No. And then finally, there's case study, and that's probably the one that most people are familiar with in the field of medicine and in public health, which is simply you have one really interesting case, and so you write up about it with the idea that that's going to be illustrative for others. It's interesting enough that you're going to be able to teach others something from it. And a question that you might answer that way are treatment considerations for a couple where both partners are diagnosed with diabetes. So the case would be that dyad, the couple themselves. And, if you have a family medicine physician who's has some really interesting ideas about how to help couples deal with a chronic disease like that, perhaps that would be something that could result in a case study. So those were our approaches. So now we're moving on to data collection methods. So for qualitative research, there are several ways that you can go about gathering your data. Those include interviews, focus groups, which are just group interviews, observations, which is where you go and observe a meeting, a community interacting in their natural setting, and then textual analysis, which is a review of documents that already exist. And that can be the open-ended questions at the end of the survey. That's oftentimes the kind of qualitative research that folks who don't do a lot of qualitative research do. All right, so let's talk about interviews. Interviews are kind of the foundation for qualitative research, primary data collection. And usually an interview lasts between 30 minutes, but it can, and several hours. I think that if you have an interview that's fewer than the qualitative research interview that's fewer than 30 minutes, you have likely not been successful at engaging that participant. Interviews are really well suited to capture rich and detailed personal perspectives. So if you're trying to gather particularly something that's sensitive and that's very personal to the individual, you usually want to do an interview. Of course, with technology now, you can conduct them in person, by phone, over Skype. There's a million different ways to conduct these things. In my experience, it's really hard to get a good read on someone on the phone, and with FaceTime and that kind of thing, technological issues are going to get you with at least one of them. So if you can do them in person, that's really ideal. With qualitative interviews, you are the instrument, right? So you're constantly reacting to the participant and following where the conversation is going, keeping track of the questions that they've already answered. So it's really useful if you can see their body language, if you can see their expressions, and make sure that they're engaged. Yeah.
Because it sounds like less of a structure with this, as it's kind of up to the participant where they want to guide the interview. Does that make it difficult when it comes time to write an IRB protocol or something like that for a study like this? How does that weigh into it?
So the question is, how do you deal with IRB, considering that that the topic guide is kind of open, and where the conversation goes depends on the participant. So in my experience, IRB officials understand that qualitative research is just different than quantitative research. So when you turn in a qualitative research topic guide, what you have are usually between 8 and 12 general questions. And I don't mean general in that, and that they're very broad, but they're open is a better word. It's not a yes or no. You have these open questions, and then you have probes under each one, with the understanding that the conversation may go elsewhere. Now, if you do the first 2 interviews, and I'll give you an example of a focus group workshop that I gave yesterday. So I was teaching some faculty from engineering how to conduct focus groups on transportation in Pickens County, Alabama. They're interested in why people don't use a certain bus system that there is that you can take from your house to go to the doctor. First of all, my first piece of advice was that they needed to make sure that all the questions were open-ended because I had a lot of yes or no's. But one of the things that they're concerned about is that in asking about that the participants are going to go off on a tangent about the new gas tax because these things tend to affect impoverished communities a lot more, right? So if that happens, then you do have to go back to the IRB, unfortunately, and do an amendment. So there's a certain leeway in terms of wording the questions as long as you stay within the content that was the original goal of your topic guide. However, if you start doing these and you realize that all of the richness and all of your stories are relating to this other thing that you didn't think of and is not in your topic guide, then you do have to go back and do an amendment. And in my experience, that's not hard at all. I had to do it a couple of times with a recent qualitative research study where I was doing interviews with young women around sexual health and healthcare access. And we got about halfway through, and about half of them were talking about mental health, which was not something that we were expecting. So I had to go back and do an amendment to my IRB to say, okay, we're going to be asking specifically about this because it keeps coming up. So what happens when you have something like that? Well, what happens is that, first of all, you need to put those questions at the end so that they don't bias the questions that come before, because you still want to be able to compare across interviews those initial questions, right? So you don't want to lose those first 10 participants just because you didn't ask them that mental health question. So you put that mental health question at the end, and then you can only look at those together. Does that make sense?
So yeah.
Yeah. So that was probably more than what you were looking for, but yeah, that is how you deal with the IRB. And sometimes you need to do capacity building with your IRB, and that's okay too. If anybody needs citations, articles about best practices in qualitative research, I'm happy to provide those as well sometimes. But in my experience, it hasn't been a problem at UAB or at UA. All right, so like I said, your questions are semi-structured and open-ended. You usually don't want more than 12 because you're just not going to get through them in any kind of timely manner. And you audio tape, and then you send that off to a transcribing company where the folks have human subjects training, and they send you back the transcripts. So your data are transcripts. The main limitation with interviews, of course, is that they're one-on-one. So it's super time intensive and resource intensive. If you're paying someone to do these, it can take a while to get a good number of them. Then focus groups are group interviews, right? This is did you have a question? So this is just the idea that you're going to ask a group of people your questions. They usually last between 45 minutes and several hours, and can have between 4 and 12 participants. Of course, this varies. I find that between 6 and 8 people is kind of a sweet spot. where you can get a good conversation going, but it's not going to get too overwhelming. You usually want to use focus groups where you're trying to get rich and detailed viewpoints that would benefit from discussion. So sometimes people don't know why they do stuff, or it's difficult for you to, it's difficult for me to cognitively access, why I make certain decisions about my own health. But if I'm in a conversation about it, that helps sort of prompt me to think, oh yeah, that happens to me too, and it can create that sense of consensus. So when you're doing focus groups, the idea is to both gather consensus as well as any different viewpoints. And there are lots of different techniques that you can use for that. It's really fresh in my mind because I just did that focus group training yesterday. Again, you audio tape them and transcribe them verbatim. And you also should probably have a note taker. If you're moderating them yourself, then you can note take yourself. But it's really difficult to keep track of who said what with a transcript, because your transcriptionist is not going to know. They weren't there. So it's usually a good idea to take really detailed notes, and I'll talk a little bit about what that looks like. If you're the moderator, you're not going to be able to take notes. You're going to be doing a lot of thinking on your feet. You're going to be trying to engage people, making eye contact. So you really want somebody else to be doing that note taking. The limitations with focus groups are, of course, confidentiality. You can't assure people that that one of the other participants in the group is not going to turn around and say what they said in that group setting to someone else. You can certainly say, okay, so I would really appreciate if you keep what we say in this room, and but it's a limitation, which is why this is not really well suited for very, very sensitive topics, because people will shut down. And of course, power dynamics play into it. So with the focus groups that they're doing for transportation and engineering, they're going through the churches and in Pickens County, and I warned them, think through how you want to recruit. Like, is it the case that you want to have the pastors in one focus group and the congregation members in another? Because it's likely that power dynamics will play out, in that focus group otherwise. Sometimes, it doesn't have to be that specific in terms of rank. It's just a strong personality that you need to make sure is not overpowering the conversation. And again, there are techniques to deal with that. So one that I like a lot is to say, okay, we're going to do something a little bit different with this next question, and I'm going to hand out pieces of paper to everybody. I'm going to ask the question. You're going to write down your answer, and then we're going to go around, and then we'll start a conversation. And that tends to disrupt that power dynamic of when you have like two people who are dominating the conversation and everybody else is just watching them. So things like that tend to help. Any questions about this group? Then there's observations. And this is literally just watching people and writing down what they're doing with the purpose of trying to understand a particular behavior, a particular interaction in its natural setting. You usually use it to examine procedures, decision-making processes, just interactions between people. And the observer or the researcher captures observations in the form of field notes. And what they teach you in grad school, actually this notebook would be really ideal. What they teach you in grad school is to take your notebook and put a line through it, and then just like how this one has it. And then on one side, you write everything that you hear verbatim, as much as you can. So you're literally taking minutes of the conversation. And then on the other side, you're writing down your impressions. So, so-and-so raised their voice at this point. At this point in the conversation, 3 people were talking at once. At this other point in the conversation, some alarm went off in the building and we had to stop. So this provides context for the actual minutes that you're taking on the other side. Recently, I was on jury duty for 3.5 weeks, and yeah, that was not fun. And I could not figure out how to get out of it. Everybody has asked me, like, you couldn't get out of it. I'm like, I don't know how. Like, they make you swear 3 oaths. And about halfway through the first day, I realized that I was taking notes of the proceedings in the form of observational research. I was taking minutes on one side and then writing down, like the prosecution looks very huffy right now, or the defendant looks like he wants to cry, like, and things on the right hand side. But that's obviously not research. But the point of this type of work is to try to understand interactions and as they occur naturally. So, for example, when I was in grad school in Michigan State University, there was this smaller city, Battle Creek, in Michigan. Has anybody heard of Battle Creek? It's where the Kellogg Company is. The Kellogg Company created something called the Kellogg Foundation because the idea was to help their own community because it was so impoverished. And one of the initiatives was to do these mini grants. So there was this organizing committee of community members that would decide which neighborhoods would get these little mini grants. And they were like mini. They were like $1,000 or $2,000 to, for example, fix a street light so that people would feel safer in that community, or to, like repaint the playground equipment so that they could take the graffiti off, like that kind of stuff. So my terrible job as a grad student was to drive my little Toyota to Battle Creek in the snow for these meetings where they would decide, and sit in a corner very quiet. These were the instructions that were given to me by my PI. And sit in a corner very quietly and just write down everything that they were doing and bring that back for them to analyze. That's not the approach that I take. And yesterday when I was providing note-taking advice to these engineering folks, I told them, I personally think that participant effect is going to be there regardless. People are going to act differently because you're there and you're taking notes. So it's better to at least acknowledge and say, hi, I'm here, I'm so-and-so, as opposed to try to hide someone, because then it's like, who's that person in the corner? But different people have different opinions about this. So I've already gotten into this a little bit. The limitation with observations is that, of course, you can't know for sure if people would act the same way if you weren't taking notes on that. All right, any questions on observation? Yeah.
Just a quick question. When you have, like, for example, this meeting that you were going to, did everyone who walked into that meeting have to sign some sort of like disclosure? That's not the right word. But like agreement that you could publish what they were saying?
That's an excellent question. So no, but because it wasn't research, it was technically program evaluation, and we weren't publishing it. This was with the purpose of trying to understand how they had come to these decisions, to build out theory, and to sort of provide the foundation for additional work that came in later years. But we weren't going to publish what they were saying. So we had, that doesn't mean that we didn't have an IRB on it though. So, yeah. So when something is program evaluation, you still have to send it to the IRB under exempt status, and then they tell you that it's exempt. So it's not, doesn't actually make sense, but that's how it is. So you need to get like the seal of approval that it actually is exempt. And then in that case, you don't need, you don't need consent forms. But yeah, it would have been nice to be able to use all of that work to to publish that. So in that case, you would want consent forms. All right. So then there's textual analysis. And textual analysis is trying to understand something from existing documents. So that can be doing systematic reviews of the literature, gathering policy reports and analyzing those. It can be looking at open-ended questions on student evaluations or surveys. So really it's just about using what you already have and analyzing that, using any qualitative textual data that you may already have and looking at it. Of course, the limitation with textual analysis is that you can't ask your documents questions. So if there's something that you're interested in that's not in there, you're kind of stuck with what you have. That one's pretty straightforward. Any thoughts, ideas? All right. So with that, let's move on to steps of qualitative research. Again, this is my idea of what steps of qualitative research are. This is how I do qualitative research. Other folks may separate these a little differently. But one way to approach qualitative research is to start by developing a research question. Then you choose a qualitative research approach. And from there, you can choose a data collection method that fits both the question and the approach. You need to develop that research protocol and get IRB approval if it's going to be for research. Then you conduct your data collection and analyses, and that's concurrent. So that's really different than quantitative. You need to be conducting analysis at the same time as you're conducting data collection. Then you write up reports and conduct member checks. Who knows what member checks are? So member checks is when you take your analyses and you go back to the community and to your participants and you say, did I get this right? And if you didn't, you need to start over. So that's not fun. But that doesn't happen very often. And then finally, disseminate findings. So let's go through each one of those. So first, you start by developing your research question. And I like to start by just Google scholaring, whatever it is that I'm interested in. You start with the literature. You talk with your research mentors, your colleagues, and other important stakeholders, and then you can start drafting. And what I put up there, let me see what this is. Right. What I put up there is so the foundational systematic review that I wrote that became the foundation for the research that I conducted in 2016 and 2018. So when I was doing my T32 here, this was part of the work that I did, was conducting a systematic review of the literature on the correlates and predictors of sexual health among adolescent Latinas. And this is really an iterative process. This is not a start with the literature, then talk to your mentors and colleagues, then draft a research question. You draft it, you go back to your mentors, you see what they think, you go back. So it's okay for it to take a couple of weeks, a couple of months for you to come up with a really good research question. Because and depending on what it is, if there's no literature on something, then it's frankly a lot easier. But if there is, then you need to immerse yourself in that to figure out what the next step would be. And is it a qualitative research question? It might be a quantitative research question. That makes sense. It's a next step. So the research question that emerged from the systematic review that I wrote, oh, by the way, you don't need to write a systematic review. Like when you're reviewing the literature, it's okay to just review it. And this is what I did. I had the T32, so I was able to do it. I like systematic reviews. I had written one at CDC as well. Yeah, it doesn't need to be that formal. So then the research question that emerged from this was, what are the barriers and facilitators to sexual healthcare access among young women in Alabama? And that became the main focus, or one of them, because this was one of several research questions, for my NCATS supplement. So it's time to choose a qualitative research approach once I had my research question, right? So one way that you can choose an approach is to ask yourself, what am I trying to do? Am I trying to gather people's stories? Am I trying to understand their lived experiences? Am I trying to develop a theory, understand a worldview, or examine or describe one exemplary case? So from looking at that question, which one do you think that it was? So it's interesting that you say that. It's I ended up using phenomenology, but my initial idea was to gather narratives around healthcare access. Sorry, to figure out, what the patterns were across the stories. That didn't actually end up working out for me. So with adolescents, it can sometimes be hard to get them to engage in that particular way, in storytelling way. So it became more about lived experiences. But phenomenology and narrative are so closely linked together because we understand our worlds through stories. So then I had to choose the most appropriate research methodology. And I think I already said this, and I did interviews. But this wasn't as straightforward as you might think. So one of my mentors was very adamant that I should do focus groups about sexual health and healthcare access for adolescent Latinas. And she thought that this would be, and specifically she wanted them to be like electronic, so like a chat room. And I had to convince her that I didn't think that was the best way to gather this very, very sensitive data. But yeah, sometimes qualitative researchers disagree strongly about the best research. So yeah. So once you've done all that, then it's time to write up your research proposal. And sometimes the research proposal is the IRB, but sometimes it's a research proposal to get grant funding. So in my case, I wrote up for several mechanisms, and then ended up getting the NCATS award. So the components of an IRB protocol are just written out there for you. For folks who may not do a lot of qualitative research, I think that sometimes it can be a bit surprising and overwhelming to realize all the things that you need to pull together to conduct it. But yeah, you of course need a lay summary, every single study procedure, how are you going to protect people's audio or videotapes, past findings, and so on. All of the study documents, for instance, if you're working with a population that speaks more than one language, like in my case, it's then all of this in Spanish. So there really are a lot of components. It's important to give yourself enough time to pull all of this together and work backwards from whatever your timeline is to make sure you have time. Questions about IRB? I'm just kind of skimming over the surface because we could spend 3 hours just on this part. All right, then it's time to collect data and conduct analyses. And like I said before, this happens concurrently, right? So you start with participant recruitment, and there's lots of different ways to do participant recruitment. You can go through a nonprofit organization who works with your population. You can go through, it depends on who your population is. You can go through particular clinics or hospitals. Usually there's a flyer that summarizes what the study is, or some sort of recruitment script. So for instance, if you're going through churches, which tends to be kind of a favorite of qualitative researchers in Alabama because so many folks go to church. then you're going to need a recruitment script that shows exactly what your recruiter is going to say on the phone. And you don't need to stick to it exactly because you don't want to sound like a robot or like a telemarketer, but the IRB does need to see what you intend to say in that conversation after the pastor or the administrator of the church gives you that list of people to call. Yeah.
Do you try to keep it consistent with who's conducting the interviews in the focus groups, or try to make it such that the two people, however many there are, that are generally following the same pattern?
I do. Yeah, I do. It's possible to have more than one interviewer or more than one focus group moderating team in the field at the same time, but I don't recommend it. I think it is incredibly difficult to be consistent across data collection opportunities if you're having different people or different groups go out. Just yesterday in this training, they said, well, we're going to have two teams. It's going to be the PI and this other person, and then it's going to be these two fellows. And I just don't see how you're going to stay consistent. If you are, it's not impossible. If you are really, really diligent about making sure that after every single data collection time, you come back and you debrief together and you make sure that any changes in wording, not content, but any changes in wording to the topic guide are consistent across however many people. You can do it. It's not impossible, but it's incredibly difficult to do well. You end up with two sets of data. All right. So then once you've recruited your participants, then you gather your consents. If you're working with youth under 18, you need to get their assent as well and parental consent. Oftentimes when working with kids, one of the hardest parts is making sure that you spend the time to answer any questions that the parents may have. Sometimes the parents want to be in the room when you're doing the interviews or the focus groups. There's of course, there are different ways to deal with that. So in my case, it kind of helps that the parents usually don't speak English, so they don't understand what's going on, and so the participant effect is not as strong. But yeah, there are a lot of different challenges with working with youth, and that's something that you would definitely want to capture in your field notes when you get back. Then it's time for data collection. Don't forget to pilot your instruments. It is so which just means testing out, right? It is inevitable that there's going to be a question that's not going to work. You're going to get out into the field and you're going to ask this question, and the person's going to look at you like you have three heads, and they have no idea what you would just ask them. I've been pulling these kinds of protocols together for 20 years. There's always one dud. So it's important to go out and make sure that you're piloting that instrument. Hopefully it doesn't change too drastically so that you can still use those data from those first few interviews. If it does, if it turns out that you have to change the topic guide significantly, then you have to set those aside and just look at the rest of them. Then you actually conduct the interviews or focus groups, whatever it is. You collect your notes. It's really important to have field notes about any observations. So the same thing that I was talking about with the observations, it's nice to keep a document where you write down any specific things that come up during the interview. So for the interviews with young women that we did, an interesting field note, and I learned this from my from my postdoc, who's an anthropologist. Psychologists don't do a ton of field notes, but she was really diligent about, after every single interview, going back and filling in, sort of her impressions and how things went. So an interesting field note that came up was that one of the stakeholder groups that we were talking to were providers. And when she showed up to conduct an interview at UMC, which is the clinic there at UA, she said, "Hi, I'm Dr. Freddie. I'm here to see so-and-so. We have a meeting. We have an interview set up." And they kept thinking she was a patient. And as she stated again, "No, I'm here for a meeting." And this happened on several occasions, despite the fact that she was stating very clearly that she was here for an interview, that she was dressed in a suit, that it just sort of didn't matter. So that was a field note that she took down about the context in which these experiences of healthcare access are happening. So then, importantly, and I have that note about gathering documents too. So you want to make sure that that if there are important documents that you need to gather as part of the process, that you get those too. So for example, if you're talking to young women about sex ed at their schools and they keep referring to a particular program, a particular flyer, you probably want to gather that and just have it for context in your files. And then you send out the recordings to be transcribed. All right, so before moving on, should we take a break?
Sorry, I just had one question about, you spent some time talking about if you have to change your script, right? Or you called it something.
Topic guide?
Topic guide.
Mm-hmm.
Do you then have to go back to the IRB and tell them of that change? Is that like an amendment? Sorry. Is it an amendment to the IRB when you have to change the topic guide?
Yes, if it's with regard to content. Yeah. So no, if you're just rewording something. So if you say, can you tell me about a time that you heard someone talk about a young woman in your community becoming pregnant? And that question flopped in my interview. That question did not work. And I ended up changing the wording for it, but it was still the same question. I didn't need to go back to that for that. But when this mental health thing kept coming up, and I didn't anticipate that at all. I didn't have it in my topic guide, but it emerged as a really important thing for these young women who are from mixed status families. Like 2 of them had their dads deported. Like, there's mental health issues that are going to be related to the health behaviors just because of the context. So we ended up adding that at the end, and that was an amendment to the IRB. So is now a good time for break? Cool. All right. Is it 5 minutes? 10? Yeah, 5? Okay.
Real embarrassed how limited my experience has been. So I don't think I've ever read a paper that reported qualitative data. So there's one thing that's telling people about the different ways in which you actually ultimately report the data.
Oh,
or
absolutely.
make with it. Because that's really complicated. The data is embedded in everything that is how you put it together in a way that tells the story effectively. It's really complicated.
There are these nifty software now that help you code, so you don't have to do it the old school with a piece of paper, and you're just bracketing out where you find particular themes. That's how I did my thesis. I had Yeah. But yeah, but now you can use in vivo or SCI and things like that. And that way you just highlight, you code it, and then you pull up a report and it's all.
It seems like there would be authors who you would find you really could understand what they were thinking way better than other people.
Oh.
Yeah.
Without a doubt. Yeah.
Is there a whole set of journals that are all qualitative research? Yeah, makes sense. There's many groups.
Journal of Qualitative Research. And, yeah, and it's fascinating. I have 2 papers right now that are revised resubmit from this study. One I was the lead author on, and the other one my postdoc was an anthropologist was the lead author on. I content analyzed because psychologists always count how many people said a particular theme. Anthropologists don't. It's just it's just a difference in discipline. So the reviewer for the one where we counted said, well, should you really be counting? And, and one of the reviewers in the other one said the opposite. Like, I really need to see counts. So it's, very interesting to see how interdisciplinary.
I have a question for you. I'm taking a class just like online through CERTL. I'm sure you've heard of it.
I haven't.
Oh, okay. It's like they do the Center for the Integration of Research, Teaching, and Learning.
Okay.
And so, anyways, the class is about designing research that is like teaching based, right? Like, so doing research in your own classroom.
Okay. So, yes, we do have something. Is that here?
Yeah.
We do have something very similar to that.
Okay.
Okay.
Oh, you're from UAB. I'm sorry. I missed the intro. I was like,
that's
like, I'm
okay.
really sorry. So you're from UA.
I'm at UA
Okay,
now. Yeah,
okay.
but I did it over here.
Okay. And so, yeah, so my question to you is, we are designing over what we would want to do in like a perfect world around like assessing our own teaching. And the way that I've done it is I've wanted to run like a pilot study, inside of a classroom and say like it's 2 weeks, and then conduct a focus group about like how well did this intervention work, right? Like, what do I need to change about it? What did you like? What did you didn't like? And so when I'm writing that IRB protocol, I need to have basically specific questions, or can they, because really I would like, in a perfect world, I would like them to tell me like what was right, what was wrong, like what I could change. But it sounded like I need to have actually specific questions that I'm going to pose to them in that focus group.
But yes, those questions, the question can be, what went well for you in, in this course, in this intervention? What challenges emerged?
Okay.
Tell me about your experience.
Okay. So they can be pretty open-ended.
Absolutely.
Oh, okay. Cool.
Absolutely. And then if you find that all the story is with regard to one particular thing, like this exercise was the worst or whatever, then you may need to go back and make sure that that's included in your topic guide. You may just want to put it in the amendment.
Okay. And then how long have you found, like, if I want to plan ahead, okay, this is when I'm going to want to conduct this intervention, and then I want to conduct these focus groups. Is there like a specified time for the IRB? Like, you should get your protocol in 3 months, 4 months, 6 months, whatever before you're planning, or is it?
Yes. So you definitely want to backcast from the time that you want to be done with your data collection and your data analyses. So it depends on how much you're doing. I think that, and how much dedicated time you have for it. So it varies widely. It also varies in how quick your IRB is. Or IRB at UA, because it's not a big research institution, and they're trying. It's pretty quick. So it's, we also don't have any internal mechanisms. So when I was here at DOPM in the Division of Preventive Medicine, there was an additional step where you had to go through the DOPM IRB or committee, whatever it was, before it went out. So with UA, I think usually I give myself a month. So if I know that I need to start data collection in June, then make sure that the IRB is in sometime.
Okay, cool. Did you have that experience of doing you used our IRB when you were here?
I did, but it was through Isabel Sprincy's lab.
Okay.
So I'm not as familiar. I would go ahead and reach out to your research mentors and to other folks who have gone through it, just to get a sense of how much time it takes, and then become friends with your IRB officer. Like I have never met.
That never hurts, right?
Yeah. I have met my IRB officer. His name is Ed Shirley. And he's super nice. And I was having meetings with him while on jury duty and on my lunch break.
And you've done so many IRBs now too. When you are going to write a protocol, it takes you, I'm sure, a third of the time or a quarter of the time it used to take you, or 8 of the time, because you just are so much more familiar. So I need to build it down too.
Examples. Don't make any of this up. Find someone who has done something similar to what you're trying to do, and ask if you can see their IRB.
Okay.
Yeah.
Think about that. I thought it was all super confidential, but we can ask to see their profiles.
Cool. Right. Very, very helpful.
Thank you.
Yeah. All right. Should we get started again? All right.
I mean, I know.
Okay. So we had left off with data collection and sending your files to a transcription company. When trying to identify a good transcription company, you can use undergrads or research assistants that you may have. I find, having had to do a lot of it as a trainee myself, I find that it's not at all value added for them. So I don't ask that of my trainees, because I don't feel like they're learning anything other than how to transcribe. So depending on what your funding situation is, you just may have to, but if you can, using a professional transcribing company is really helpful. And you can look online and make sure that they're human subjects trained. I have some good ones that are also able to do translation, that are able to do text, audio to text in different languages. And it does get a little bit pricey, but in my opinion, it's worth it. Transcribing is so awful. Has anybody ever transcribed? Yeah, it's hard. It's cognitively exhausting. Even if you have one of those nifty pedals that let you stop the recording without using your hands, it's still hard. All right, so then it's time to analyze the data. And what I have up there is a picture of what your data looks like. It's an actual transcript. And what you usually want to do is to start by reading through your transcripts and identifying, I usually just do this by hand, and identifying what the main themes are for your questions. And then you can go back and actually start coding. And coding just means that you're going to be chunking out the parts of the interview that relate to a particular theme, and you literally just write in a code. I like to start very granular and then theme up from there. So begin with being very, very descriptive and go up from there. An important tip is to make sure that you are not just coding a tiny part or a tiny fragment of something. Make sure that you capture both the interviewer's question as well as the answer, because otherwise when you print out reports, it won't make sense. You'll have no idea whether or not something is miscoded or not. And I mention reports because almost no one does coding by hand anymore. Usually people use software. And one of the more common software packages is NVivo. Who's heard of NVivo? Does that sound familiar? So NVivo is a software package that you can install on your computer, or you can probably download it from the IT folks here. And what it allows you to do is to import your transcripts, which are just Word files, into this interface, and then you go through and you code, and you can ask for a report on every code, sub-theme, or theme, and it does so automatically. The other way that people do this is by using a big table like Excel or Word, and literally just copying and pasting pieces of text. That's a lot more cumbersome. I strongly recommend software if you have the time to learn it. And it's pretty intuitive. It's not that hard.
Is there any dabbling with like machine learning to actually read through the transcripts and create the themes itself? Has that been successful?
So there are tools within NVivo that allow you to identify particular words or phrases and code those automatically. Of course, you need to go back and make sure that it's correct. There's little things like a typo by the transcriptionist will mess you up. Yeah. And there's some things that you're just not going to be able to capture that way. So in my interviews, for instance, the young women would go back and forth between Spanish and English a lot. It's really hard to be able to capture that through a find function. So once you've started conducting your data collection, you need to start doing your thematic analysis, because qualitative research really sort of depends on you being able to follow the story. And the best way to do that is by identifying the themes as you go, so that you can tweak your topic guide with regard to wording, and go back to the IRB if you need to with regard to content. And then once you perfect that tool, then you can just like finish out the rest of the interviews or focus groups usually. It's really important to keep a really detailed audit trail. So any change that you make, even if it's one word to your topic guide, make sure that you keep track of that, whether it's with track changes. I have a ton of PDFs in my server that are, where I've written handwritten notes about how I've changed my coding scheme, for instance. So you usually want to keep a coding scheme in the form of an outline. Every time that changes, you need to keep track of that. This is just about helping you keep track of how you made your decisions, and this is about transparency. You can then show that to reviewers if they have interest in it. Triangulation is just about hearing the same thing from different sources. So in my case, I was talking to providers, I was talking to young women, I was talking to parents about health and healthcare access, right? And there were some themes that were similar across, like for instance, there are not enough interpreters in Tuscaloosa, So we got some nice triangulation around that. So that's what one of the things that you're looking for, especially when you're looking across groups. Then there's coder consensus and inter-rater reliability. This is one of the hardest ones. So you usually want to work with a co-investigator to code your data, so that it's not just one perspective, so that you have some sense of the right word is not objectivity, but some sense that that is really what was there, right? The way that I do this is that I get the transcript and I make 2 copies of it. I give it to my co-investigator or fellow researcher, and we code independently and we come up with our coding list. Then we meet, and these meetings are intense. They usually take an hour and a half, 2 hours, and go code by code and quote by quote, talking through how you coded each chunk and why. And then you come up with a consensus. Then you separate again, and you you use your new coding scheme until you agree most of the time, right? These software programs have a way to do that, to establish integrated reliability automatically, so which is kind of nice. So if 2 people are coding independently, it can tell whether or not you've hit your 0.8, whatever it is, 0.85 for integrated reliability. And then we've talked briefly about member checks. So these are all the things that you do to ensure rigor in qualitative research. Member checks is just, going back to your community, going back to your participants, doing a quick focus group, or going to your community advisory board and saying, does this resonate? Is this what, does this have face validity for you? And there's just a quick list of the data management analysis software. I like NVivo because there's a lot of free trainings for it. So if you're going to learn one, it's nice to do the one that you can just go online and take the free trainings for. All right, and then finally, after all of that, you have some results to look at. So this is just an example from the project that I've been talking about. So in our case, we interviewed 20 young women. How did we decide to stop at 20? When we got saturation on our main questions. So has anybody heard the word saturation? Does that make sense? So saturation on themes means that you're no longer hearing new themes across interviews. And you can keep track of that very formally by continuing your analyses throughout, or once you sort of figure out what the main themes are in your field notes. That makes sense? Yeah.
So if you design your questions to reach this point sooner, do you tend to small sample size?
Sure. If it's a really simple question, you can have a sample size of 8, and then if you only have 2 themes. Yeah. I consider a theme to have reached saturation when at least 6 people have said it. Yeah. All right. So the eligibility criteria for my study were that the young women needed to identify as Latina, needed to be 15 and 20, had lived in the US for 5 or more years, and lived in West Alabama. 65% of them identified as Mexican, which is about in line with the community in Alabama. 45% were between 15 and 16 years old, and 60% had health insurance. So this is what my data, yes?
So what if only 65% identified as Mexican, but they had to self-identify as Latino? What were the other?
Guatemalan, Salvadoran.
Just more specific.
Yeah. What else did we have? It was Guatemalan, Salvadoran, I think one. Caribbean, like Puerto Rican or something. Yeah. So this is what the data actually look like. This is how you report the data. And I pulled out a specific question that we had on the interview. So if you were in a room with students learning how to be doctors or nurses, what would you want them to know or consider when treating young Latina women? And these are some of the answers that they gave. So this theme, what we ended up calling it, was the need to talk privately to their provider. And this young woman says, so that they should know that and ask the mom to leave the room or something like that, because no one really wants to talk about that stuff with their parents, talking about sexual health, because they might get mad and stuff like that. They would have more confidence in telling the doctor. And this other young woman said, well, definitely if they are going to ask a young woman, very young Hispanic woman or a Latina woman, preferably any sexual questions, not doing it in front of their parents, because the chances of them being more honest for their answers is better chance than without their parents in the room. So you can see that these hang really well together. It was a clear theme that emerged in our interviews. And, you know, with these interviews in particular, you're looking at the intersection of race, ethnicity, and gender and age, right? And I think that this is a concern that probably all young women going to the doctor for sexual health have. It's not necessarily specific to young Latina women. So it's important to make sure to pull that out and mention that when you're writing it up as well. So this was another theme that emerged. And we ended up breaking these up. Yeah, I like that one. Yeah, maybe they should just learn Spanish. Yeah. We ended up breaking these up into need for interpreters / language barriers, and another one with regard to cultural competence and humility. So I'll let you guys just read through that. Yeah.
This is trivial. I just wonder what the numbers mean at the end of each thing. That's just your way of keeping track.
That's my way of keeping track of who said what, because when you have these really long reports, it's really difficult to remember who said what. And even for presentations, I just like to pop the number up there so that if I'm reminded of something interesting that I want to go back to, I can go back to that interview. Just in terms of naming conventions, the girls were 1, and the providers were 2s. I think the parents were 3s. So a young woman interview number 3 would be 103. And a parent interview number 15 would be 250 or 350. So it helps too, so that you can easily visually see, what stakeholder you're looking at. All right, so I'll let you guys come up with a theme for this. What do you think? How would you call or theme that?
Compassion.
Mm-hmm. Compassion. What else?
Interpersonal connection.
Mm-hmm. Yeah. I honestly can't remember what we started theming it.
Yeah.
I can't remember off the top of it. It's been about a year and a half since I looked at these data. So. All right. So then finally, it's time to write up and disseminate your findings. I like to start by presenting the data back to the community. In qualitative research, the lens is that you kind of owe it back to them to report back and say, this is what we found. And we do that in the form of our community advisory board, which is made up of community leaders. And the next step that I like to use is informal presentations with people in my own lab, just to get a sense of how this is sounding to other people, and what things they are finding to be the most interesting, the least interesting. Yeah. And then finally, it's time to send it off to conferences. I think that we've presented different parts of this study, like 8 different conferences. And then finally, write up manuscripts for publication. Sorry. And right now I have to revise and resubmit based on this work. And I was telling Dr. Chaplin, the way that you write this up is that you pull the quotes and the themes, and then you describe what you found. And if you're interested, there's some really good qualitative research in American Journal of Public Health and really any public health journal we can find some qualitative research. Increasingly, journals are asking for you to provide data, so which means transcripts. So it's helpful to, on the front end, ask your transcribing company to remove identifiers, because that way you don't have to spend a ton of time going through 500 pages of data and removing it later. So that's it. Questions?
Curious how it's, I'm just trying to put myself in the mindset of thinking this way, and how you figure out if what you're doing is really new. And it seems like it might be harder to search the literature in a way to know whether what you're doing has been done before. But maybe I'm wrong about that. Maybe it's pretty straightforward, and that the search algorithms are really good at cross-referencing qualitative kinds of language effectively.
Right.
And it is the standard that it's a good thing to have data that addresses the same question 2 or 3 times in different populations, or similar but different populations, or is it hard to get something published if it turns out somebody did something just like what you did and published it 6 months ago?
That's funny that you say that. Yes, define hard. I am on my 3rd submission of one of these manuscripts. We finally got revised and resubmit, so that's good. And one of the things that I heard from the editor was someone published a study that was similar to this in Maryland, but they did it in Maryland with young Latino women. Like it had been like 3 months before. My understanding is that the context in the U.S. South is so different than in the North that that's still valuable and it's still a contribution. So I just kept submitting it until someone thought that agreed with that and thought that it was valuable as well. But yeah, absolutely, it can definitely be hard, especially when there's this emphasis with qualitative that has to be something that no one has ever done before. I mean, with quantitative as well, but with qual and this exploratory lens, it can be challenging. What was your first question? Oh, about making sure that that you're doing something new. I rely a lot on my mentors and on going to the conferences to make sure that I really am on the cutting edge of what's been done. Because yeah, you can search the literature and it's likely that you'll miss something. With something as specific as sexual health promotion with adolescent Latinas in the U.S. South, it's me. That's it. There was one doctoral student in Wake Forest a couple of years ago that did a dissertation, and that's basically what there is. But if what you're looking at is a little bit broader, then you want to make sure that you talk to your colleagues and that you're not missing something that maybe is being done but not published yet.
And can you comment briefly just on the issues of what kind of agencies want to fund this kind of research versus what ones you can not bother to submit to?
Yeah, well, NSF is probably not going to fund you. However, NIH has some institutes that will fund qualitative research. NIMHD, NICHD, NIMHD is health disparities. NIMHD is minority health. I'm sorry, that's the same one. NICHD is child development. So yeah, so there's different ones. NCI, National Cancer Institute, funds qualitative work. And to get pilot work done, you can absolutely do that with foundation funds. The Ford Foundation likes to fund qualitative community-based participatory research. So there are different options. Yeah.
So as far as
Similar question, but submitting to the peer review journals as far as submitting qualitative manuscripts, is there one that you find are more receptive to qualitative research? I know I've done quite a few writing of qualitative articles, which, well, we thought were very well, but we're constantly getting rejection, or every now and then a revise or resubmit.
Mm-hmm. The most important thing about publishing qualitative research is to make sure that the journal that you're looking at publishes qualitative research. So look at do a search for the last 3 years and see if they've published anything that was qualitative. Take note of how they format it, how they present those findings, and try to use that as a guide. Yeah, you're definitely not going to be successful just submitting it if they haven't published a qualitative research study in the last 5 years. But in my experience, quantitative and qualitative, it's just sometimes takes a few tries to get things published. So that's not necessarily a bad thing. It just sometimes takes a little while for an article to find its home.
you talked a couple times about sometimes qualitative data that lead you to a quantitative study.
Mm-hmm.
Do you think it's valuable to, so you mentioned how qualitative studies can sometimes open the door to quantitative studies. Is it valuable to have skills or training in both of those areas, or to kind of collaborate with people who are experts in one or the other, if your expertise is in just one of the two?
Oh, absolutely. Yeah. I think that that is one of the oddest things about doing a PhD, that you are expected to just do this thing by yourself. That's not really how any of this work happens. You definitely want to build a research team that includes all the different expertise that you need to get the project done. In my case, I don't have, and make sure that you have your mentors, your mentoring team as well, with their different pieces of expertise. And in my case, I don't work with anybody who does what I do exactly, but one of my mentors does Latino health, another one of my mentors does HIV and sexual health, and you just kind of build it together, and before you know it, you're the expert in it because you're doing it.
I think I'll just take this moment to reinforce one of the things that the CCTS really is trying to emphasize, is that the more that we can develop as translational thinkers, the better. And
Absolutely.
that really, to us, means knowing enough of the vocabulary of what other disciplines do that you can talk to the person who could become your collaborator, recognize that they're out there and that they have skill sets that you don't have that can really enrich what you're doing, and see the ways in which things could be connected. And do people ever publish papers that are a mixture of qualitative and quantitative data? I'm assuming they do. And is that, seems like that might be in some ways more challenging to write, doing it that way. But, maybe it's just straightforward.
No, it's conducting 2 studies and writing 2 papers, basically. But it can be great to, especially if you conducted a study that had both components to, if you have a large enough word count with that particular journal, to include both. It's really nice to be able to say, this is what we found, here are the counts, and the percentages, and what predicted what, and here's some more depth on why. Here are the mechanisms that underlie these relationships.
Okay, any other questions or comments? Well, thanks very much, we really appreciate it.
Thank you.